All right. And you are on. So thank you, Jasmine. Take it away.
Thank you for having me today and for being interested in reflexology and how it can help people of all kinds and with all kinds of issues. I'd first like to just say who I am and what I do, what my credentials are, so you know a little bit about me. And then I want to bring up a share screen and bring up some images while we're talking. And then I'll talk about what reflexology is and what the benefits are for you, what a typical session is like. And after that, I thought we would open the floor to you know, questions and stuff like that and discussion, if that's cool with everybody. I don't want you to feel like you can't ask, so I don't want you to feel stifled if something comes up and you want to say something. But, you know, if it's a bigger conversation, maybe we should wait till, anyways, let's just see how it goes, okay? Just want you to be comfortable with me. So my name is Jasmin Jahal. I'm a certified professional reflexologist. I was trained in a school that is nationally recognized. There's not many of them in Chicago. I had to go out to Woodstock to get training. And I am also a professional member of the Reflexology Association of America. So it's a nationwide organization. And I'm a graduate of DePaul University. I was trained in what they call the Ingham Method of reflexology, which is the international standard of reflexology. I have a practice at home. Now, we're sitting in my office right now. This is not the reflexology room. I'll show you in a minute a picture of my room here. So I have my own little practice, and I also work for the Cancer Wellness Center, the Illinois Masonic Medical Center, and the Carrington Retirement Home. My approach for reflexology has always been much more than just relaxation, which is a great benefit, mind you, and everybody will get that out of it. But I was always interested and intrigued by the medical side and the medical benefits of it. So right from the get-go, I extra focused on how can it help people. And even in school, I did extra homework on it. Believe it or not, I think things sometimes are destiny. I did work with research for breast cancer patients and how reflexology can help. So it kind of opened the door for me, and it's been a really interesting journey, especially when I worked pretty strongly at the Cancer Wellness Center in Northbrook. It was a very rewarding experience. So I'm going to turn on my share screen if I may. Just hang on till I get there. Share. And then I have to figure out how to get to my images here. Come on. So tell me, can you, just this is a test image. Can you see this?
Not yet. No.
Nothing? It doesn't share?
Did you hit
Share screen?
your share screen?
Share.
There, it's going. Yep, we can see it.
All right, so this is my little banner. Let's see. So that's me. I have a website if you want to check me out. It doesn't say it there, does it? It's my website is bloomintowellness.com. So, and that's my certificate. So I'm for real. And I wanted to start out with talking about what is reflexology. It's a health treatment that's been around for thousands of years, and it can be seen in the ancient Egyptian hieroglyphs that is found at a pyramid called Saqqara, which is the step pyramid, one of the oldest pyramids in Egypt. You can actually go inside and see, can you see the pointer? You can see this hieroglyph there. And actually I have a little bit bigger diagram of it. You can see here, now this is just a sketch of what is on the wall. It's not a picture of it, literally. But you can see this is what they're doing. They're literally working feet and hands. And it describes, the Saqqara pyramid talks a lot about medicinal things that they knew at the time. So I found it really fascinating because I've been to Egypt and I've actually been at Saqqara. So I don't know what's happening. Things are dinging over here. Gail is waiting to enter the waiting room. Okay, sorry. So anyways, so you see it's gone back thousands of years. This is not something new that's been created and somebody, you know, in the last few decades created some new invention. It's a for real thing, like Chinese medicine. It's been around a very, very long time. It's a protocol. You probably have seen some maps like this before. It's a protocol of manual techniques that you do by hand, that it's very unique to reflexology. You're not doing massage techniques. They're very different techniques that you do. You apply them to the feet, the tops, the sides, the bottoms of the feet, and or to the hands. The techniques, they're intended to hit certain nerve endings in your feet, and there's 7,000 nerve endings in your feet. They have done the research to back it up that says where those nerve endings what it will stimulate through a neural pathway through your body, goes up the neural pathway into the spine, into the brain, and back out again. And then what it does is supports and assists the body to rebalance, go to homeostasis, that's the word of rebalance, and to function at an optimal level. Kind of like in Chinese medicine, where they're trying to move qi, if you want to use those words, if people are familiar with acupuncture. It is the same and similar. They have shown, are you going to take care of admitting everybody who's coming late?
Yeah, I got it.
Okay. So now these maps, you're going to see them, sometimes you've seen them in the mall or something. They're very basic. When we study reflexology, the maps are much more complicated than what we see here. But this gives you a rough idea, and I have one. I'm going to show you another one. This is the one I have hanging up in my reflexology room. So people can look over my head and look at it while we're talking and I'm doing the session on their feet. And they can see better, I think, on this map. So sometimes you see the bottom of the foot reflects different organs and systems, or the inside, the medial side of the foot, or the top of the foot, or here's the other side, right, you know, inside and outside, the lateral side too. So we have to look at the foot 3D, and this is the foot with the body in anatomical position, right, standing. There's also a map that applies to the feet in a person who is in fetal position, so all curled up, their legs are crossed and their arms are crossed. So it's a little complicated, but that's my problem. That's not your problem at all. When you're here to get a session, you don't have to worry about this, but trust me that there's been a lot of study that goes in to know what to do, where to go, how to touch, and what to feel for. We really had to learn what kind of textures you feel in the foot, and it's pretty mind-blowing sometimes how well it works. So the concept is to touch certain nerves that reflect or correlate to different points in the body, and then you're using specific alternating pressure techniques on the foot or the hand to stimulate the nervous system that then helps balance the whole health of the body. It's recognized by national health institutions that this is a distinct complementary practice. They use the word complementary now and not alternative health practice. It's complementary because it works in tandem with Western medicine, provided the doctors are open to having that happen. And unfortunately, in cancer centers, this is actually great. This is actually very, very good. Let's move to the next picture. It's supported by different formal research studies, including the National Cancer Institute. And we really try to educate everybody we see to tell them it's really a lot more than a foot massage. Certainly the first thing you're going to feel and think it is a foot massage, a very special one. But it's much more, because the purpose behind it is much more than just stroking and releasing and moving lymph. It's really intended to work the nerve endings. I'm going to go to the next. This is my little room at home. This here is the chair. I always put fresh sheets on everything. I clean everything. Obviously, it's, especially nowadays, you have to be very careful with everything, mask and all that. But it's a chair that ends up reclining back. So the legs go, once you sit down, the pillows come out. You're going to lean back in the chair. The feet get lifted up like a recliner. And then I actually set one of the pillows under your calves so the feet are propped up or even higher. So the intention is to bring your feet higher than heart level. That way, it's very good for your circulation at the very least, and it's very relaxing. And it's one of those chairs, it's a very simple chair, but boy, you just melt into it. I hope one of these days I get to show all of you and you get to see how it feels. I use a little bit of lotion that's over here. I have a little bit of lotion that I use. So there's no friction at all. It's not an oily thing. It's very comfortable. It doesn't make your feet slippery when you get up and when you're finished. Okay, so you have an idea. I think there's another picture of my room. I don't know. I just wanted you to see a for real room where we actually do the work. There's me. There's a picture of me working on somebody's foot. You see it's all by hand. There's no tools. We don't have any tools that we use other than that little bit of lotion. There's no metal tools or anything we press on your foot except all by hand. It's very important for me to feel what the ends of the nerves are telling me. And I usually share that with my clients because I'll say, oh, well, here, this is this point, and I feel something here. And if I feel something, usually it indicates something is going on there, it's out of balance. And or you will feel something. You might feel a little bit of pain, or it might feel tingly, like the nerve endings are all tingly. I have a lot of patients who have neuropathy, and sometimes they feel absolutely nothing. It's a numb spot, and we work on stimulating the nerve endings to work again. And as you know, with chemo treatment, one of the side effects is neuropathy at times. So it will put it at bay and or assist getting over it much faster. And this is working the bottom of the foot. And by the way, my left thumb is actually on right under the diaphragm in the solar plexus area, just so you know. And every point has a place, and it's fun because we have a nice conversation. I don't mind sharing what I know or do, but I am always focused on what is going on in the procedure, in the protocol. So as with acupuncture, as I mentioned, reflexology moves qi throughout the body. It removes blockages and it allows for healing to happen. It's the typical session should be held in a private place that's quiet and relaxing. The session generally should run 50 minutes to 60 minutes long for it to really be effective. And you would remain completely dressed. As you see, here's the lady laying in the chair. She has all her clothes on. She just has to take socks and shoes off. You would sit in that recliner and you see how high her legs are, pretty high, but it's not uncomfortable. It's not like you're tipped so badly that you feel like blood rushing to your head or anything. It's very, very relaxing. Your job, in fact, is to sit down, tell me what's going on, with you, how you're feeling, what has happened since the last time I've seen you, about you physically, and then just to relax. Your job is really to relax into it. The more you relax, the better it works. Usually we take a medical intake form, and it gives me a place to start working on your feet. We'll discuss how you feel and your health issues. Even the smallest concerns is something you should share, because we can help it. We can help you in every way. So you want to be able to speak comfortably with me, and know that it's, of course, very private. It's good to tell the practitioner if, as we go along, if something is painful. It's not like I'm going to open up a point of pain and then you're going to walk out the rest of the day feeling pain there. It's not like that at all. It's just, as I'm working the points, sometimes you get uncomfortable, and it's good for me to know. Sometimes I can feel it and sometimes I don't, and you might feel the discomfort, and then I need to hear it from you. By the end of the session, you will be surprised at how calm and centered you feel, and sometimes you even feel like you're floating on air when you walk out. It's really incredible how kind of a high that you get from having the relaxation and the stimulation of the nervous system. Let me see what else we have here. So there's a hand session that I'm working on her hand, and would work the whole hand. And I actually work down the forearm a little bit, because there's a lot of tendons that reach into the wrist and the hand that are tight, for especially people who work on computers a lot, or people who work with their hands. Sometimes there's neuropathy in the hands. So there's alternate points to working the hands and the feet. There are people I've had who have diabetes and have a missing toe or foot that is removed. And so I go to the hand as an alternate place. So it's I think, more relaxing through the feet, but sometimes people really like to have the hands. And I also use the hand as a place to show you a point or two that you might be able to work on between sessions, or when you're going into a chemo treatment and you want to really try to help recenter. There are certain things that I can teach my clients to do that will help them in between. So it's not like I can teach you how to do reflexology, but I can teach you certain techniques that will be helpful. So let's go to the next picture. It's a little one. The benefits of reflexology are pretty vast. It reduces stress, it reduces anxiety, it helps with depression. It is a great natural pain reliever, believe it or not. It actually can eliminate pain. Primarily people in chemotherapy sessions, when they're going through their treatment, if we do reflexology in conjunction with the chemo, and generally right before you have your next session of chemo, the chemo actually will have less side effects, and it will actually work better for you in tandem with reflexology sessions. You'll have improved body functions, like your digestive tract will work better. Your hormones will be more imbalanced. You'll sleep better, which never hurts. You'll have an increase of circulation of blood and oxygen and lymph. And what else? It aids with your medications and whatever supplements that you take. And it also is helpful in delaying the progress of some condition or degenerative situation. I'll move forward. So here you see an example, a simple one, of where what we call the spinal reflex is, which is on the medial side of your foot, and it runs from your big toe down underneath your ankle. And I usually start my reflexology session working that reflex, because that's the biggest, nerve in your body is your spinal cord. And so I stimulate the spinal cord first, and then from that side reach outward and work all around the whole foot. To me, that makes sense. I have a special protocol that I go through, so I never miss any spot. And whenever we have certain issues we want to address, you'll see that I'll go there, I'll work on those areas, I'll leave and work on other areas and come back and keep revisiting the ones we want to give special emphasis to. So it does help. Our idea is alternating pressure. So you go on it, you go off, you go on it, you go off, you go away, you come back. And by the end of that's why it takes a little bit of time. So it's not a 15-minute quickie. You don't really get anything out of the session if it's too short. You need to be able to relax and let it be, let it unfold. Let's see. I love this quote. I think this is a smart man, Dr. Joe Dispenza. So that's why I put this here. It really does help. And you see, here's another thing I like to put up. I have a Facebook page, and I always put posts up there for my clients of things that I think that will be of interest and that will remind them of ways that I can help them. I also like to make suggestions to my clients about what they can do at home that's easy and can help alleviate pain and or depression. And right here is an example of a foot roller. You can get a wooden one. There's ones you can purchase that are meant to be laid on the floor and you roll your foot on. Or you can simply take a bottle of water, freeze the water so that it's hard, especially if you're in pain. You want to then roll your foot over. Of course, this only works the bottom of your foot, but there's a lot of points at the bottom of your foot. And usually in the arch, this is very helpful because it really will, there's an adrenal gland point in the arch of the foot. And if you don't know where it is, but if you're rolling over the arch, you're going to hit that point. And what does that do? It reduces inflammation in your body. And the adrenal gland is what deals with the stress in your body too. So it assists, believe it or not. It really hits a lot of points, but that's one of the most important ones that a foot roller will help. And you can do this at home nice and easy. You know, you want to do it for a couple of minutes. So think a couple 120 seconds, you know, sometimes 2 minutes feels like a long time. But if you're watching TV or something and you're just sitting and you just roll one foot, do that for a while, then switch, go to the other, and then you're good. And you can certainly do it right when you get up in the morning. Some people have plantar fasciitis issues where they have trouble getting up out of bed because there's pain immediately. You can roll on the foot before you just sit up, sit on the edge of the bed, roll the foot, stimulate the nerves, release the pain, and then you can get up and you're able to move around more easily. Let's see what else we have here. Oh, well, that's kind of corny, but that's true. I really do love my clients. I also suggest things like soaking the feet in Epsom salt. So you could either make a foot bath with Epsom salt, warm water, or try to go hotter water if you can. Put a tablespoon or two of Epsom salt in, or take a bath in Epsom salt. Just put a couple tablespoons in the bathtub and soak. Your skin is an amazing thing to detox out of, and the magnesium in the Epsom salt draws out toxins from your body. And when you're in a situation where your body is in stress because you're in pain, or it has an issue that it's trying to heal, your body is working overtime, and it really is helpful to do things that assist it to do its job, because your body knows what to do. It really does. We just have to get out of the way sometimes and allow it, and not mask it all the time with medication. And just the process of using medication, you have to flush that out of your system, drink more water. It all works together. And when it's done right, it really makes a big difference. It really helps. So I don't have any more I don't believe I have any more pictures to show you, so I'm going to stop sharing. I hope they were helpful in some ways. And does anybody have any questions or anything for me? Because I'm here for you for that reason.
I'll start us off. This is Becky. I'll start us off because sometimes I think we need to get the ball rolling so everyone feels comfortable to start talking. So you mentioned that you can use reflexology in cases of people who have neuropathy, and I know that's a frequent complaint here.
Mm-hmm.
Is there any, and I know everyone's different and treatments are always different, but do you see a significant improvement over time in patients who've suffered from neuropathy, even if it's years after chemotherapy treatments?
Well, yeah, I have worked with people who have neuropathy for different reasons, for many, many reasons. Mm-hmm. And it is something that takes time, because what you have to remember is the neuropathy means the nerve isn't communicating. It's just sitting there, and it's not sending the signals that it needs to back up to the spinal cord and the brain. So we are trying to work those nerve endings, bring blood to them, actually manipulate the nerve ending and get them to wake up again, so to speak. And little by little, it improves. I have a client that has feeling back in her feet now completely. And I've worked with her now for about a year, once a month, every month, without fail. She comes for an hour and she has regained it. There's some neuropathy, I can't fix everything. There's certain conditions like type 1 diabetes that has, if somebody has some severe neuropathy, I can only assist so far, but it doesn't hurt. And it's better to feel tingly than nothing, right? And the one thing I want to mention is if there is neuropathy and we work on it, the first reaction, and we call it a health reaction or a health response, is to feel pain. The first time you feel the nerve react and be alive again, it's going to feel painful because it's felt nothing for a while. And it's not pain like you're going to fall over, and it's not like that kind of pain, but it won't be comfortable because the first sensation will be one your body thinks is pain. And if you can accept the fact that that's a good sign and come again, we'll get past the pain part and it then becomes normal, right? You're going to feel normal again. It'll get tingly, and then you know how everybody can relate to if you sit on your foot the wrong way and it gets numb, and then it gets tingly, and then it comes back, it's warm, and it comes back to normal. Those are the stages we'll look for as we do our process. But it does take time, and it shouldn't be something to be afraid of. So I'm just going to put that out there, because a few times I've had people, like once I had a Parkinson's patient, and in the very beginning of our sessions, she would literally shake more. And she got so freaked out by it that she didn't want to come back. And I had to try to tell her and her doctor that I'm not doing anything to make things worse. I'm actually stimulating and making it better, but it's going to feel uncomfortable first. So I hope I made that kind of clear.
That's good. I have 3 questions that popped up. Two are kind of in the same bend. One person had asked, like, if they attend a session with you, I'm assuming like through your business, how much does it usually cost for a session, and do you use insurance coverage?
A session, I charge $60 for 60 minutes.
Okay.
And no, they're not covered by insurance.
And then another one had said, is there similarities between acupuncture and reflexology?
Some, yes, in the sense that we are both trying to move energy through the body to release blockages. Are we using the exactly same places or points in the body as acupuncture? Some overlap, some do not. So no, in some cases we're very different because I only focus on the feet. And the acupuncturist will focus on everything, right? They'll put a needle in your face, on your head, and every which way.
Okay. Is there any sort of different, and this is my question, like different benefits of doing feet versus hands? Like, do you prefer manipulating the feet other than you mentioned if someone is missing possibly a foot or having more issues lower?
Well, I guess I prefer feet first and then using the hands as an alternate. But if you think about it, there are sometimes advantages to doing the hand over the foot. So if you think of your foot, let's say you're looking at your foot, and this is the bottom of your foot, right? It's a big, long foot with little tiny toes. And now you're looking at the palm of my hand, which is the bottom of my foot, essentially, here. It's much smaller than my foot. My foot's a big, well, I don't have a big foot, but it's got a longer palm, so to speak. And what would be related to my toes are my fingers, and my fingers are much longer. I mean, I can get in between them easier. I can work the length of the finger, the tips of the finger, the pads of the finger better and maybe easier than the toes. Sometimes people's toes, they have knuckles that are crunched up, right? Or they have issues, calluses on the feet that make it very hard to get in onto the nerve. I can go to an alternate spot on their hands that correlates the same and actually get a better effect. So.
Okay. Someone else had asked where your office is located. Just more interest in sessions.
I do it out of my house, and I live in Norwich, which isn't far from Lutheran General. It's by Montrose and Harlem.
And then I have another question. Is there any sort of condition that's, medical condition that's contraindicated when it comes to reflexology? Is there anything that you should not pursue reflexology for?
Well, basically two things. If you have blood clotting issues or anything like deep vein thrombosis, that kind of thing, we don't do any reflexology. And if you're in your first trimester of pregnancy, we don't do reflexology because you could lose the baby.
Oh, wow.
But after
After
the first trimester, I have lots of mommies. I do.
I'm sure they appreciate getting anything that can relieve discomfort that's
Oh, yeah.
in the body. Now, when you're practicing, is reflexology, is it like holding in different spots like a pressure point, or is it massaging, or what's it like, if someone has never had it done before?
Well, first I will apply the lotion and do what we call relaxation techniques. So I work the overall foot. I will start on your right foot. And so I work generally. Then, as I mentioned, I'll go to the inside of the foot and work the spinal reflex. When I work the spinal, so let's pretend this is my foot, right? I'm going to take my thumb. This is very common for us. We call it thumb walking. So it's like press and release, and move, inching little bit by little bit, move it up, 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 up. I don't know if you can kind of imagine me doing this on your foot, right? That's one technique. There's several. We could press and find a spot. You can roll circular motions. There's longer motions that we work through the foot. Sometimes I use my knuckles and work down the bottom of the foot. Of course, when I'm working the inside, outside, or top of your foot, I use softer techniques because it's primarily more bony there, and I don't want to hurt you. That's not my goal. So I will use softer, my fingertips and softer strokes on the tops of your feet. Moves your lymph system, believe it or not. So it's a little hard to describe,
Yeah.
but I don't know how else to tell you. Is there anything better way I can describe it?
No.
It's very different because massage therapists will never use their thumb like this. They might use their elbow, I don't know, but we don't use our elbows.
So I have two questions that kind of correspond to each other. One had said, have you ever found a possible issue someone may not have been aware of? And do you tell them? And in the same bend, another person said, what if you have a blood clot and you don't know about it and you come in for reflexology? So,
Well, that's scary.
yeah.
Yeah, well, that's a good question because I've never had that happen where someone's had a blood clot. And, most often people who I see because they have a condition, they're pretty aware of what their doctor has told them and what their status of their body is. So I've not ever had an issue with that. What was the first question?
Have you ever found, here, let me go back to how they,
Oh, did I find something that they didn't know about?
right. And do you tell them?
Yes,
Okay.
depending on what it is. Yes, I do. I'll ask questions first to see, because sometimes I find something that you forgot to tell me. So, okay, something benign. Let's do this. Easy one. I work on somebody and I'll go, oh, are you having your period? Because I can tell by touching your feet, right? I mean, so I have younger clients that do, or I was working on someone's kidney point at one point, and I said, well, this is interesting because I'm feeling something here that I'm not used to feeling. And she's like, what is it? And I said, well, there's a little point above it. For me, it feels like there's a head of a needle right above your kidney. And her eyes just went boing. And she said, do you know what I just found out the other day? I have a benign tumor above my right kidney, and I was working her right kidney point.
Oh, wow.
It was amazing. It really was. I've worked on people who had bladder infections and they didn't know it. And I said, well, I'm touching the bladder area, and it's indicating something. I want you to pay attention. At the very least, drink a lot of water, because if it's a UTI coming on, you need to do that to feel better. What else? I had, for example, a lady told me she had one of her ovaries removed. And she didn't tell me which, and I didn't think to ask at that moment because we were talking about a lot of things. And I was going along, I went right foot, went to left foot, and in the left foot, I said, just out of curiosity, was it the left ovary that was taken out? And she said, yes, how could you tell? And so it's really awesome, even for me. I get excited, as you can see, because I'm not one who's a magician or something. All I can do is tell you what I feel. And from experience, I felt very different things, but there's actually some sameness for conditions between one foot and another foot. And it's been pretty awesome. Oh, another one that I think is pretty common is the shoulder area. We have a shoulder reflex. If you have any rotator cuff issues, if you sit at a computer a lot, you're hunched a little forward, then you're going to have some issues in your rotator cuffs, and it's pretty common. It's in the foot, and it is dead on. I mean, it's amazing what I feel, and then how it sometimes usually causes pain for the person as I'm pressing on that point, but it alleviates the pain and the tension up here.
My question, is it important for people to be hydrated well before they come to a session with you? Does that make any difference as far as, I mean, I know hydration after and clearing fluids, or is it more important after, to hydrate?
My answer to that is it's important to hydrate all the time.
Okay.
And I always tell people, alkalize the water, right? Put a little bit of lemon in it, a lemon slice, a teeny slice of this. Look, even my water here, I have lemon floating around in it. Alkalize the water so that it helps drive the health towards a more alkaline side, which is where you're going to be more healthy.
How successful, someone had asked, like, when you're dealing with back pain, does reflexology help with back pain?
Yes. Beside your spinal cord reflex, our muscle, we do work your muscular system too. And I can actually say to you, oh, it looks like you have tension in between your shoulder blades. Oh, looks like you have low back or sciatica. That's a lot of pain from the low back and down. And there's various points then I would work to assist that. So yes, it should alleviate, reduce the pain a
All right,
lot.
so I assume similar sort of relief with arthritis. Someone is asking about arthritic pain, like in joints, like knees.
Yes, and think about arthritis. It's inflammation in your body, right? And remember earlier I told you one of the places I work inflammation is your adrenal reflex. And so we will work a series of places to assist the inflammation to bring it down. So yes, it will help arthritis.
So let me see.
These are great questions, by the way.
Very good. This is the most talking we've had or chatting during a session. So you've definitely touched, a good nerve because people are very interested in finding out how this can help. You did bring up, at the beginning of your training and now continuing about working with breast cancer patients. Like, what is it through the research and using reflexology specifically with breast cancer that seems to be a good fit or helpful?
Oh, okay. In the sense that obviously we have points in the foot that we can help you that are specifically for the lymph system around the breast to assist you as well with the chemo and the radiation treatments that you have to go through. It has been shown in research studies that it can take the pain that you're living with down by 40, 50, up to 60% naturally. So you're leaning heavily on meds. Sometimes you feel sick from taking the meds. This is one way to take less of them, so to speak. And then they say that it assists the chemo itself to destroy the bad cells more than the good cells. So it was very fascinating to me when I did homework on the research of it, of breast cancer and reflexology.
So we have another question. Does reflexology help with like overactive bladder issues?
Well, first of all, if you're sitting in the chair and you need to go to the bathroom, you're going to have to go to the bathroom because it will stimulate you wanting to go, unfortunately. Will it? Probably in the sense that it will slowly, it would only work slowly to help subside it. It can't fix the situation. Does that make sense?
Yeah, I think that's a good answer. Another person asked, and this might be similar, you said, how many sessions to make a difference and how often? Or when do you start seeing, I guess, a response?
Okay. So first of all, depends on the severity of the situation with you. Sometimes people who are in a lot of pain and or if they're going to, let's say you have chemo every other week for, I don't know, 6 weeks or something, you want to do it more often. Ideally, sometimes I've had people once a week, but ideally, usually it's every other week. And then once it starts, that we see progress. And I actually take notes. Every time I see you, I take notes of what I did, where you felt pain, what I felt, where are you, what did you report when you came in, how did you feel when you left. And I actually will have a little paper trail that I can easily show you. It's not like it's a secret of the progress as we go. So we have like a little book that we're creating for each client. And as you do progress, you then will back off on the number of sessions or the frequency of the sessions so that it's less and less and less often.
Okay. Another question, does it help scar tissue? I'm not sure if there's a certain area or that it just says, does it help scar tissue? So I don't know if that's too vague to answer.
Well, do you mean like internally scars that are maybe there from a surgery or something, or like scar? I don't know exactly what the question is referring to. Obviously, I cannot make a scar go away, but if there's something inside, because sometimes scar tissue is hard,
Yeah.
right? So obviously, if it's in your foot inside, I will be working right on top of it. And if you're not having discomfort too much, I will work harder at it to try to dispel it. But I can, as far as actually on the surface scar, I don't think I can make a change.
All right. And then another person said, can a session help? Are you working on more than one issue? For example, like neuropathy, back pain, sciatic pain?
Yes.
Uh,
I'm going to work all the body systems, your
Okay.
endocrine, your circulation, your cardiovascular, your everything. You name it, we're going to hit it. So I want to know going in everything. And even as we're going, if you go, oh yeah, I forgot to tell you, say what's going on. It's better to put it all out there. And then as we communicate through the session, it, I think, works better. If I see you regularly, I get to know you and your feet and your situation. And sometimes people come and sit down, and after a minute or two, they just kind of doze off because that's how relaxed they are. And I can certainly still do the session with you sleeping. It doesn't disturb me. I know what I'm feeling. I know what's going on. And you're in the ultimate case of relaxation when you're sleeping. So it's actually a compliment to me if you fall asleep on me. But you don't, you don't have to. It's not necessary.
And one more question. Someone has said, if a condition is quote unquote solved, is there a maintenance schedule? Like, I'm not sure if your back pain's improved. Is there a maintenance schedule to continue with reflexology to help?
Do you have to? Well, you don't have to, of course. I do have clients that will come anyways every 4 to 6 weeks or every other month, just because they like it, they're relaxed, they want to stay on top of issues. And always there's something, oh, now it's my sinuses because the weather is changing. Oh, now it's, I don't know what. Everybody has stuff, and it will always help with stress relief, with headaches. And those are just normal problems, right? They're nothing too extenuating. It's just, it's like when you go to see a chiropractor, they like to see you every so often to keep you tuned up, so to speak.
Okay.
That's ideal, but it isn't absolute. So
that was one of my questions I wanted to ask you. So if you see one patient and you find out issues that they're having in that one session, then can you determine that, say, like, this patient may need 3 sessions with me to get some better results? Would you know that in the first session?
no, I mean, what we need to do is we do the first session, and then I need a second one so we can revisit how did you feel when you left here? Because you're not just going to feel better the minute you leave. You could feel a better 24 hours later. You could feel better for 3 days before the pain starts to return. We have to get a gauge of what it is we're working on and what is your reaction to it. And then if you come a second time, we do the same thing. We'll judge, where were you? How are you? How much time did it take before stuff started resurfacing?
Okay.
That's the way to tell the progress. I can't sit there and say, well, Sam, you're going to definitely need 10 sessions.
Okay.
I don't, to me, that sounds like an infomercial. I don't do that. I don't do anything like that. So,
I have one more question. Do you see patients that deal with fibromyalgia as a pain management?
fibromyalgia is one of the autoimmunes, and autoimmune diseases are ones that I see a lot of.
Okay.
Because regular medical world doesn't really know what to do with them and just throws a bunch of drugs at the people, or say, hey, I don't know, it is what it is.
Mm-hmm.
That stinks. I mean, nobody wants to be told that. I can't help you. I don't know why it's there.
Yeah.
So yes, it helps. It does help with managing the situation. Yes.
Okay. All right.
Mhm.
Thank you.
And then I know we're getting to the end of our time. I have one final question. Someone said, do most people see you because they have an issue, or do some schedule a session like they would a massage and just want to feel energized?
I have both.
Okay.
Some people come just out of curiosity and go, "Oh, I want to see what this is. I want to try it. Tell me, what is it?" Oh, so while we're sitting there, I talk about it, and then they get to feel it for themselves. On the other hand, I have people who specifically say, "Oh my God, I got to do something. I don't know what else to do. I'm going to try this." So I have everything.
Oh, that's great. Well, we thank you so much for your time, Jasmin. We're excited to be meeting you in person in the coming
Oh,
months.
the
And
in-person world. I
I
can't
know.
wait for that again.
We get tired of the two-dimensional world, so it'll be nice to have some contact. And I will pass along also in an email to all of you your bloomintowellness.com website if anyone wants to peruse more information about you, so they kind of get some other info. But is there anything else you want to leave? Any parting thoughts for us, Jasmin? I mean, you just gave us a ton of thoughts. Was there anything else you would like to say to us before you go?
Well, just that Bloom into Wellness is spelled Bloom N2, not into, not INTO. Bloom N2 Wellness. If you want to look for me there, you're very welcome. I don't mind getting phone calls with questions or emails or anything. If anybody, I want you to be comfortable with me. I think that it can be a very enjoyable experience helping you. And I'm here to assist. So every issue and every question is what I'm here for. And know that I do this really from my heart. So I'm really excited to be able to come into the center in the new year. I really am. I hope I get to see. I get to see some of you.
And last thing, if they go to your website, can they find your phone number, or would you rather them go that route, like to send a message through your website if anyone wanted to contact you sooner than when you were here, or what's the best way to reach you?
You can through the site, or I can just say the phone number if you
Sure.
want.
I'll write it down and then I can pass it on.
773-979-5351 is my cell phone. You can text me, you can call me, or you can look through the website. There's also a contact page there, whatever email, whatever is most comfortable. There's a Jasmin Reflexology Bloom into Wellness Facebook page. Whatever, everybody has a different way they like to reach out. So.
All right. Well, thank you so much for your time. We appreciate it. And we just hope you have a great night. And you've given us so much great information. So thank you again.
Thank you for having me. I really appreciate the opportunity. You guys take care of yourselves, and I hope I see you in the new year.
All right. Bye.